Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry. Welcome to another episode of Modern Chiropractic Mastery. This is your host, Dr. Kevin Christie, and today I am going to discuss positioning in your community. I'm going to use being a disc injury expert as the kind of topic that we roll through. But when we have our coaching clients, one of the things we always do, and I even had this in my book that was published by Parker University, Doing It Right, Modern Chiropractic Marketing, but it's the audience builder tool. It really helps you have a clearly defined audience and then a clearly defined message to get there. So I'm going to kind of roll through that tool that we use, but then use the disc patient as kind of our example as we do run through this. Okay. And, I think a lot of chiropractors could strongly consider, really trying to position yourself as the disc expert. Obviously, there's plenty of chiropractors that have, there's certain modalities, like say decompression that does that. There's certain trainings on understanding disc injuries that do that. There's, this isn't, anything revolutionary as far as a chiropractor becoming a disc injury expert, but I want to kind of talk about how you could get your message out there a little bit more, right? And when we go through this audience builder, the first thing we do is the XY axis of positioning. It's a Seth Godin concept, and you got your vertical and horizontal axes, and you got your four quadrants. And on the vertical axis, say you got expert on the top and non-expert on the bottom. And on your horizontal axis, you would have something like maybe generalist or wellness. And then on the other end of that would be something very specific, like let's call it disc patients, right? And you want to do enough to become the expert in disc injuries, and you got to move that needle up out of maybe the non-expert disc quadrant to the expert disc quadrant. And that's going to happen, various ways. Yeah. Being clinically skilled at it is a huge one. That's kind of the table stakes. But if not enough people in your community know about what you do and your expertise, then in the eyes of enough people, you have not reached expert level, right? You're kind of in that non-expert level because frankly, just not enough people know you. Okay? And if you're lucky enough and you work hard enough and you're brilliant enough, you can sometimes even transcend the profession, right? Like certain folks, someone that would come to mind would be like Stu McGill in disc stuff. I know he's not a chiropractor, but he's kind of transcended and he's become one of the experts in it nationally. I guess I should say internationally. I don't need you to worry about becoming the international expert in disc injuries. If you do, awesome. But let's assume that's not going to be the case. I need you to be the expert in your community. And when you can really hone in on that and say, yeah, I want to do that, then we can actually make progress in turning you into the expert in disc patients. And again, I'm just going to use disc in this call, but you could apply this to anything else. If you wanted to be desk workers or runners or, plantar fasciitis, foot, ankle, right? Any of those, you could do a lot of different things. So step one is getting clear on how you want to position yourself. And we've done that. We're going to do that with discs. Okay. Then you got to determine, the psychographics of your ideal audience, right? Because I could break down a lot of different psychographics of disc related patients, and that the psychographics are going to be different than the demographics, right? So demographics are going to be age, gender, income level, education, that type of stuff, and that's fine. Doing marketing towards that is not an exercise in futility, but I think starting there is not what we want to do. We want to actually focus on the psychographics, and that's going to be the personality traits, values, attitudes, interests, and lifestyle of the consumer. Okay. And so some of the things that come off the top of my head on psychographics that a lot of chiropractors, kind of yearn for in their patient base are people that are health conscious, right? You could have the disc patient that's super healthy and is a power lifter, right? And very health conscious. You could have a disc patient who is a cigarette smoker, sits at a desk, 10 hours a day, hasn't worked out in 10 years, and is 30 pounds overweight, not very health conscious. You may not want that psychographic. You want the disc, but not that psychographic, right? Another psychographic could be active lifestyle, could be, obviously values natural solutions. There's people that get disc injuries and they want nothing to do with natural solutions. They just want to go under the knife tomorrow. Um, other psychographics, high quality of life, maybe weekend warrior, seeking health longevity, right? Those are the things I would say are on the some of the examples. There's probably many more, and you can work through that of psychographics that most chiropractors are looking for. And so when you're setting out to say, yeah, I want to be the disc injury expert, um, I want, but I want patients that have disc injuries that are mostly in these psychographics. It's not going to be perfect, right? You are going to have that cigarette smoking, sitting 30-pound overweight, hasn't worked out patient in your practice. It's going to happen. But when the majority of people in your practice fit the psychographics you like, then you can handle the ones that don't. It's when you're 80% of your practice are psychographics you don't like, where you start to get frustrated, burned out, and you're not getting the satisfaction you want out of the results you're getting, frankly. And the results are going to be hard with those people too. So that's step two is determine the psychographics. And then, yeah, you can do a kind of a demographic check and say, okay, obviously with disc, there's going to be an age component. We know that. You might also say, you know what, I'm out of network with insurances. It's a little bit higher cash rates. I do need people that can afford my care. So there's a financial demographic there that you might consider when you go to figure this out. Chiropractors, if your website traffic or Google Maps visibility has felt a little unpredictable lately, you're not imagining it. A lot is changing behind the scenes. AI is reshaping how search results show up. Competition in the map pack is getting tougher, and simply ranking well does not always translate into new patients. That's why Propel Marketing and Design is hosting a free chiropractic SEO workshop. You'll learn what's actually changing with Google Maps, how AI is impacting the way patients find and choose clinics, and what small, realistic updates you can make this year to stay visible and competitive. This is not a high level talk or a bunch of jargon. It's a practical step by step workshop built for busy clinic owners who want clear direction and next steps they can actually implement. Save your spot for free at propelyourcompany.com/MCM SEO workshop 2026. And we'll see you there. Now we move on to step three, which is determining groups of people that you want to target in your marketing and your messaging. And what I like to do here when I've gotten clear on, say, a type of condition that I want to target, like disc, I will say to myself, okay, who suffers from disc injuries, right? Could be golfers, right? That could be a group of people. And what I like to do here is like, okay, I'm gonna pick a condition like disc. I'm gonna pick a group that suffers disc injuries, and then I'm gonna do my psychographic cross check. All right, golfers, yeah, health usually. Active lifestyle, right? A lot of them do value natural solutions. They do want a high quality life if they want to play golf. They are seeking health longevity, right? A lot of them are weekend warriors, and a good amount of them are health conscious. Then you can go and do your demographic check. Yeah, golfers usually, if they can afford to be golfers, can afford your care. And they're usually of a pretty good age that suffers from disc issues. You also might want to deal with stenosis. I'll let you figure that out if you want to also be the stenosis expert, but we'll move on to just focusing on disc for this sake of this podcast. Right. I would say desk workers would be another great one. Strength, power, weight lifters, people like that for sure. Right? Other rotational sports. I mentioned golfers, but it could be tennis. Could be CrossFitters, right? Definitely could be that. And so start to think about what I could. There's a laundry list of them, but you get the idea. Like start thinking about where you would find these groups of people that do deal with disc issues and then check the psychographics and check the demographics. And now you've got your groups. That's a big part of building a clearly defined audience is okay, what groups of people? Then what you would do is when you're building this out is let's just take golfers, right? So I'm just going to focus on golfers with the disc issues right now. Um, you want to figure out where you find these golfers. There's offline congregation points and there's online congregation points. Offline congregation points going to be golf courses, country clubs, golf stores, teaching professionals, golf specific personal trainers, right? All really good ways in the community to get referrals and do workshops and get, a teaching pro is a good gatekeeper where they can send you many people. And so start getting out there. That's the offline congregation points. And then you get the online congregation points, right? It could be something like Facebook specific targeting. If you're TPI certified, TPI golf referral director they have. Maybe there's a closed Facebook group in your area of golfers. Instagram's good. YouTube searching for golf health and performance tips is prevalent. And then frankly, with the online congregation points is if you create a lot of good content, articles and videos and posts on social media and stuff on your website and messaging around it, you will sift, sort, and screen through everybody and you will become a magnet for those golfers that are dealing with disc injuries, right? And if you do a good job of just creating disc injury content and you're good at treating discs, then golfers will find you, and other providers would refer to you as well, right? So an offline congregation point could be, primary care doctors and obviously MD orthos that are looking for conservative care of disc injuries. Maybe you're McKinsey certified and you connect with other PTs. There's other people that you can connect with that would attract referrals for disc patients. Let's take a short break from today's episode to tell you about the best decision I've made in my clinic in the last 10 years, and that has been adding shockwave therapy to our clinic. The outcomes have been really impressive. Certain conditions we were struggling with in the past, we're now seeing results with the shockwave therapy for that. And second of all, the ROI has been really good. You know, when you make a big investment in something, you want to see a return, and we're seeing that return in clinical outcomes and in our investment, and that's been really nice to see. I chose Keenest Medical for 4 reasons. One is the technology is top notch. You have to have great technology. There's a lot out there that isn't quite up to snuff. The second thing is they have a really good clinical training. They have an exclusive partnership with Academy of Shockwave Excellence so that you can become clinically proficient in shockwave. You do need to get skilled at it. I think that's a big differentiator between practices that are getting great results and seeing the ROI is they have a great clinical aspect to that as well. So you want to get trained appropriately. Third is they have in-house service team for all of your technical support, which is key when you're investing in a machine like this. And then lastly, they have a very in-depth marketing and business support for you so that you can launch this into your practice effectively, that you can get that ROI on it, that you can get the clinical outcomes. And they also have really good financing options if you need that. So go to keenestmedical.com, KINAS medical.com, mention MCM podcast and receive a free shockwave in practice book with a purchase of a unit. So that's keenestmedical.com, KINAS medical.com, and mention MCM podcast. All right. So now you got clear on, okay, I got I'm positioning myself as the disc injury expert. I want these types of psychographics. These are the groups that suffer from disc injuries. I'm going to do a cross check of psychographic and demographic. Then I'm going to tease out where I'm going to find those groups like golfers and desk workers and really have a plan of attack to get out there into the community. And now that's your clearly defined audience. You know, I went through one and you would go through different ones. And again, you could do this for other things. You don't have to only treat discs, as you can imagine, but this could set you up really nicely to target this in your community and, you know, put a megaphone to your expertise and amplify your message out there, and people will start considering you the expert, right? Now, I'm gonna touch on one thing here on the messaging side. So usually when we go through this audience builder, We spend kind of half the time building on the audiences that our client wants. Then we spend the other half on the messaging around it. And one of the things we do, and I'm just going to work on the golfers again on the messaging, is if you're familiar with building a story brand by Donald Miller, he has 7 characteristics of a story. I think it was chapter 17 in my book. I got clearance by Donald Miller to write about it and tease it out how it pertains to chiropractic. So you can reference that. You can go to Amazon or my website to get my book if you need to. Um, but he talks about the 7 characteristics of the story, whereas one is the character who has a problem, which is 2, meets a guide, which is 3, who has a plan, which is 4, and then calls him into action, which is 5, avoids failure, which is 6, and leads to success, which is 7. Okay. In this scenario, the golfer is our character, which is 1. You're the guide, which is 3. The problem, number 2, Donald Miller breaks down into external, internal, and philosophical conflicts. And how that would relate to, say, a chiropractic situation here is the external conflict, in my mind, is going to be the diagnosis, right? The low back disc injury in the golfer. That's the external conflict. The internal conflict is the driver that says to this person, I need to go see somebody for this, right? We all know, like, a lot of people deal with pain for a while before they actually do anything about it. It's the internal conflict that motivates them to seek a solution, right? And so some of those internal conflicts for the golfer might be they don't want to miss out on the member golf tournament coming up. Being able to satisfies their competitive drive. Socializing with friends is important to them. Not being able to play golf makes them feel old, right? Those would be the internal conflicts where they raise their hand and say, I need to see someone for this. Now, who are they going to want to see? And then there's the philosophical conflict here, which is maybe they don't want surgery. They're trying to find someone that's not going to put them under the knife. They don't want to be prescribed long periods of rest. They don't want to go to that doctor and say, yeah, stop playing golf for 3 months. They don't want that. They don't want pain medications, right? A la Tiger Woods. Afraid they have a disc herniation that will prevent them from playing golf. And they have all these nightmare concerns about what a disc herniation is. Okay. That's a philosophical conflict. And when you get clear on your messaging on the content you create or the conversations you have with golf pros, or you do a workshop and you're clear on this and you position yourself as the solution to get them back to playing golf quickly without pills, drugs, or surgery and long periods of rest, that's why people want to go see you. Right. And if you do this long enough, because they may hit the internal conflict and say, yeah, I need to see someone for this, but they can go see orthopedists, physical therapists, other chiropractors, like all these other people that they think they can go see. We need them to think of you. And when you do this long enough and diligently, you become the expert that solves their problem, right? And so you need to get clear on those messaging points for this. And we tease this out for a lot of different types of audiences that chiropractors would want. And then from there, you're going to apply this messaging to your website, to your blogs, to your videos, to your patient communication, to public speaking, to your meetings, right? That's something that we work with a lot on our clients on getting clear with that. And so now, if you do this right, you will um, have the clinical skill set that you are confident in to actually assess and treat disc injuries. And you are now um, possessing really good positioning, audience building, and messaging to get the message out there concisely and consistently to motivate enough people to come see you and turn you into the expert, right? And I think you can get amazing results when you combine. I shouldn't say I think, I know you can because I see it all the time. And obviously, early on, and I just kind of mentioned it, is you do have to become really good at uh, disc patient care, right? Because the killer is when you think you can put lipstick on a pig and have really good marketing and messaging and get people in. But if you don't have the goods and you don't get people better, then it's just not going to work out. Um, you're going to struggle. You're going to spin your wheels. It's when you have good messaging and marketing and you get out there consistently and people come in and you get great results that the whole thing just takes off. And so I implore you to continue to get even better with managing disc related issues. Okay. Um, and I know you can, and there's a lot of ways to slice it. One of the things that I know a lot of you heard about and like is McKenzie protocol. I think that's a great one. I don't have any um, official sponsorship or anything with them. I do know that MPI is actually having a master series on the disc, and it's going to be with Brett Winchester, Mark King, and Tom Lotus. And Tom Lotus is really he's a good example of someone that has positioned himself as an expert in disc related issues on a pretty high scale, and to the point where he's now teaching it with MPI. And obviously, we know about Mark and Brett and their skill set. And so, if you really want to enhance your evaluations and assessments and treatments of disc patients and be able to really hone that, I highly recommend you check out that Master Series Disc seminar. So it's a really good one. It's going to be on June 6th and 7th. It's going to be in Chicago, easy to get to. Good weather in Chicago in June. I'm usually in Chicago for June. It's amazing weather. So it'll be there. And again, that's going to be Brett Winchester, Mark King, and Tom Lotus, June 6th, 7th, 2026. Just go to motionpalpation.org. I really believe in what MPI does, as you know. I believe in the training they do around the disc. I know there's other things you could supplement it with, but if you go here, whether you feel like you're a beginner or even advanced with disc stuff, this is going to get you even better than you currently are. And then you'll have all the confidence and conviction to then work on what I just talked about for the last 20 minutes here around positioning yourself as the expert with great marketing and messaging around that. And when you marry the two, great clinical with great consistent marketing, that's when you will develop the patient base that you want and grow the practice that you desire. So check that out, motionpalpation.org, June 6th, 7th this year. You will not regret it. Hope that was helpful for you to understand how you can position. Again, I used the disc as our example today. You could use injuries, right? You could use sports. You could use patient populations like pregnancy and pediatrics, right? There's a lot of things you can do. I wouldn't do too many, right? If you try to please everyone, you please no one. And I think getting really clear on 4 to 6 really helps you get going and building a great strategy for your practice.
MCM is raffling off one free ticket to the MPI disc seminar. So just email me, kevin@moderndeskjockey.com, and I will put all those names into a raffle and do a video draw on who the winner is. So get that in as soon as you can, and we will announce when we will do the draw for the free MPI disc raffle. I hope you enjoyed this week's episode. And if you want to make the shift from busy, broke, and broken to time-free and cash confident, or you just want to continue with the exponential growth, check us out at modernchiropracticmarketing.com. Look at the MCM Mastery tab, watch the short video on there, and check out what we are doing now for evidence-informed chiropractors. We are equal parts coaching and marketing done for you. Yes, you shoot some videos, we help you with campaign strategies and ideas and really become a thought leader in your community. You shoot those videos, you send them to us, we produce, edit, and brand them to you. Then we distribute them through all of your channels. We also take them and we turn it into one good blog per month. And every other month, we have Darcy Sullivan producing a robust blog with a topic that you pick from her database to help with your SEO. So we essentially become your content marketing agency to make sure your practice is always having ethical, elegant content marketing to help grow your practice. On the coaching side, we also help you with everything from marketing ideas to business, communications, finances, anything practice growth, and really try to help prevent you from being stuck on that island. And we hold you accountable. We have a great group of doctors that are just doing amazing things, and we look forward to help you out to take that next step in your practice. So again, check us out at modernchiropracticmarketing.com and learn more.